After the reversal of Roe versus Wade and with Texas set to ban almost all abortions in the state, stricter access to abortion medications is one of the many challenges doctors face in Texas, even when those medications aren't used for abortions. And physicians tell the KVUE Defenders the public needs to know how our state's abortion laws directly affect non-abortion patient care. Here's investigative reporter Jenny Lee.
Most women's healthcare providers are concerned and unsettled.
In his 29 years of practice,
I fight every day for mothers and their babies.
Dr. Todd Ivey never imagined this day would come.
We are now being restricted by laws that tell us we can't provide that appropriate treatment, and then patients suffer the consequences.
The obstetrician gynecologist has relied on evidence and science-based medicine to decide how to treat his patients. He now has to consider a lot more.
Very concerned.
Even before the U.S. Supreme Court overturned Roe v. Wade in June, Senate Bill 8 banned abortions after 6 weeks in Texas. It allows for private citizens to sue anyone who helps someone get an abortion. Plus, a total abortion ban is expected in Texas soon, triggered by the reversal of Roe v. Wade. Then there's a 1925 abortion ban that was never formally repealed.
Well, it's become very confusing.
One exemption to SB 8 is a medical emergency. But what determines a medical emergency is up for interpretation, which Dr. Ivey says is leading to compromised patient care.
There's a reluctance to treat until there is truly a life-threatening condition. And, sometimes that leads to prolonged or impairment.
Dr. Ivey is also concerned about how the new laws are strictly limiting access to abortion medications, even when those medications are used to treat other medical conditions like ectopic pregnancies, several types of cancers, and inducing labor.
These medications are often used if a woman who delivers has increased bleeding and has what we define as a hemorrhage. We use these medications to help contract the uterus to decrease her risk of transfusion and further problems from excessive bleeding.
Dr. Natalie Crawford took her concerns to social media. In May, she posted in part, "Last week, a pharmacist declined to fill a prescription for a patient of mine with an ectopic pregnancy, citing SB 8 restrictions." But at Terrytown Pharmacy in West Austin,
I'll have to find which bin it's in.
Pharmacists don't automatically turn down those prescriptions.
Here you go.
Instead, a software program flags all prescriptions containing drugs used for abortions like misoprostol and methotrexate, 2 drugs with multiple uses beyond abortions. Once the system alerts, pharmacists like Fuller Curry take a closer look.
This is just one other step that we're having to take, is that for these particular medications, in addition to the regular things that we're doing, making sure that it's safe and is being used for in an appropriate way, we just have to make sure that it's not being used for a prohibited reason.
Curry says some pharmacies aren't filling abortion medications anymore, regardless of use, all because they're scared of legal repercussions.
There are some pharmacies that just do not fill for these medications at all. We're not one of those pharmacies. We believe that if there is a legitimate, non-prohibited use of the medication, we trust our pharmacists to evaluate that and make that clinical decision that yes, this is being used for a legitimate reason, and there are many legitimate reasons.
And so now with the overturning of Roe and the eventual banning of abortion in Texas completely, all of those medications are going to be more difficult to receive and more difficult to get and potentially impossible.
Dr. Jenny Villaficencio is with the American College of Obstetricians and Gynecologists, the nation's largest OBGYN professional group. She says overturning Roe will also affect fertility treatments.
When you have government bodies like governors or the Supreme Court or the federal government starting to say things like life begins at conception or life begins at fertilization, which is really a philosophical or religious belief, not a scientific fact by any means, shape, or form. When you start hearing that, you start getting into questions about things like IVF and making an embryo outside of the body and then implanting it.
Then there's the privacy issue.
We have received calls from pharmacies saying, well, I want to understand the diagnosis. And I have very grave concerns about, is that a violation of the patient's confidentiality, then to have to share the medical diagnosis with others outside of the system.
Doctors are also concerned that the reversal of Roe may lead to more maternal deaths. According to a new University of Colorado Boulder study released in late June, maternal mortality could increase by 24% nationwide after total abortion bans go into effect. That's 210 deaths. For physicians like Dr. Ivey,
this may be a setback for us.
It's another unintended consequence in a post-Roe world. For the KVUE Defenders, I'm Jenny Lee.